three amazing panelists, that is Dr. Baliram Parsewar, Dr. Himani Sharma, and Dr. Anuja Jadhav. Welcome you all three, and I hope we have an amazing discussion ahead. So, the topic for today's discussion is the first period, what to expect after pregnancy, the first period that you get, when will you get it, how is it going to be different? We're going to address all these questions in the discussion today. But before we start with the discussion, I would like each panelist to introduce himself, starting with Dr. Balaram.
Namaskar. Myself Dr. Baliram Parsewar. I am an obstetrician gynecologist and infertility specialist practicing in Vasai Nalasopara region since 17 years. I am a gold medalist and recently I received an award from Economic Times as inspiring gynecologist of India. I am having bad voice today, so please excuse me for voice.
Thank you, Dr. Balaram. Dr. Himani?
Hello everybody, I'm Dr. Himani. I'm doing obstetrics and gynecology in Government Medical College in and I've been learning a lot and it's taught me so much and there's so much there and to teach all the women out there, women health, menstrual hygiene and so much more. Let's dive into this question, can't wait anymore.
Thank you, Dr. Himani. Dr. Anuja, over to you.
Yeah. Hi everyone. I am Dr. Anuja Jadhav. I am a homeopathic consultant, a yoga trainer, and a psychological counselor. And I've been practicing in Hadapsar, Pune since past 5 years. And glad to be a part of this discussion. Thank you for having me.
Thank you so much. It was a great introduction from all the three of you. So let's dive into the topic. So today, as I mentioned, we're going to discuss about the first period after pregnancy, after childbirth. How can women have some internal changes maybe? When can she expect a period? So we'll have a round of questions to all the panelists, starting with you, Dr. Balaram. So the first question to you is, when can a woman expect her periods after a childbirth?
After delivery, it depends whether she is breastfeeding the baby or not breastfeeding the baby. Second thing, is she breastfeeding baby regularly or irregularly? If she is breastfeeding baby regularly, that is called as typical breastfeeding. If she is breastfeeding the baby irregularly, so she may get periods by 6 weeks to 8 weeks, 6 weeks to 10 weeks.
Okay, thank you. So, Dr. Himani, my next question is to you. How different is the first period after pregnancy as compared to the ones that we get in normal before pregnancy?
Well, there's a big change between the bodies happening. Female is going same, like body is going to adjust to the new thing, new menstrual cycle after the delivery. It's exactly like she's resetting her body. So after delivering a baby, she will undergo through a lot of changes like the uterus lining, all the blood that has to shed. So usually female after delivery she will have a heavy menstrual bleeding with a lot of cramping, lot of intense pain, and irregular cycles. So basically, in all, there is a term called lochia where there's a vaginal discharge. So she has to differentiate between menstruation and that. Sometimes you have to exclude if she is undergoing PPI. There's like clots coming out, so she has to literally educate, like she has to be in a setting taught ki what is lochia, what is menstrual cycle, what is PPS. Like she should be able to differentiate all these terms. So basically, menstrual cycle after the delivery is something that she has to be like literally taken care of by a healthcare doctor or somebody who has to tell her.
Thank you, Dr. Himani. So over to you, Dr. Anuja. So my next question to you is, what are the exercises or yoga poses that a woman can practice after childbirth to manage menstrual cramps? Since she is not allowed to do all the exercises after childbirth because of maybe a vaginal stitch or a C-section stitch, what exercise would you recommend?
Yeah. So basically, what happens in periods is that the cramps occur because the uterus is squeezed and the inner blood and material and tissues have been expelled out by the body. So the things that occur are the abdominal muscles as well as the pelvic muscles are included here, and they go through contractions. So, in order to relieve or release those contractions, the easiest way that women can go through is basic and easy, light stretching, is what they can do in order to relieve those pains. Second, very good and very easy exercise which can be done is walking, because it, as we all know, it releases the feel good hormone, and she will feel a bit better after she is moving and walking around just the house. And also, she can do some basic yoga poses that can be done at home. For example, she can do the child pose or the balasan, which looks like this.
Right.
Then the second one that can be done is Supta Vakrasan, which basically is this, and can be done by females who have had a vaginal delivery or a C-section, and it won't harm them or won't prolong the process of healing. Then the third one is this, which is the butterfly pose. This also helps a lot of females to relieve those period cramps, especially after pregnancy. And the fourth one is the crocodile pose or the Makarasan. And there are many other yoga poses that can be done, but as each and every pregnancy journey is different and the way the body heals in every female is different, they need to consult their gynecologist or yoga trainers and then go ahead. But these are the basic things that can be done by everyone.
Thank you so much, Dr. Anuja. That was quite an insight. So,
Thank you.
coming back to you, Dr. Balaram, as you mentioned, breastfeeding, the women who breastfeed may have a delay in their menstrual period, the first menstrual period that they get. Can you elaborate more on this? How much delay can they expect? When should they be worried if they're not getting periods when exclusively breastfeeding?
In our practice, we saw lactation phenomena even after 18 months, 24 months. But commonly, patient gets menses by 3 months. Nowadays, so many mothers go for top feeding along with breastfeeding. Some part breastfeeding, some part top feeding. The, if you go to the rural area, their breastfeeding is more as compared to the urban area, because there are so many working women in the urban area. So there are some restrictions. So many times they may not be able to breastfeed the baby completely. So they go into category of atypical breastfeeding. And even during menses, they can have a breastfeeding, absolutely no problem for breastfeeding during menses also.
Okay, thank you. So, Dr. Himani, as you know, we were discussing about how different the period is from the regular periods. The women who have PCOS, do they face any excess difficulty or they have prolonged delay in their periods after pregnancy?
Yes. Well, it's like how they were facing menstrual issues before getting pregnant. They were having irregular periods and they were having like heavy menstrual bleeding. So the same thing will be continued even after her delivery. She will be having a long period of amenorrhea where she will be having a lot of cramping and all of that. So basically, in her issue was like there was a hormonal imbalance, so which will be continued even after her pregnancy. So she again have to take all the medicines to regularize her cycle and have a ovulation during her cycle. So basically for her it's very confusing state whether she is ovulating or not ovulating. So she has to track hold of all her menstrual like basically if she is breast, so she it's a natural form of contraception, but she has to make sure that she's taking a backup contraceptive as well, and tracking her ovulations. So if it's like after 6 weeks and she's lactating, the lactating mother, and she's after 6 weeks and she's having bright red bleeding, so which is basically considered as menstruation. So she have to look into all these things and
Oh,
continue medicines and everything will be continued.
okay. Thank you, Dr. Himani. So, Dr. Anuja, my next question to you is since breastfeeding is already a very tiring journey for the mom because it makes you a lot of, it gets a lethargy of fatigueness because you're breastfeeding your child over and over again very frequently. And during that period, when you get menstruation, the fatigue and the heavy menstrual flow that we get, how can a woman manage that?
Okay. So basically, what happens postpartum is the sleep cycle of the females is disturbed to another level. So, in order to deal with the fatigue, the basic thing that she needs to do is manage her sleep cycle first. Like, get as much as sleep and rest as much as possible. along with the new changes that have occurred, which will help in relieving the fatigue or at least feel good throughout the day. Then the second thing which is missed usually is hydration in females. It is very important to stay hydrated because as they're breastfeeding and there are issues with not sleeping well and many other situations, the hydration levels are usually very easily neglected. So just here and there, they can have coconut water or fresh water juices or sarbats, or we have many options in Indian culture. So it is easily available. So that should be obviously considered to avoid the fatigue. Then the third thing which can be done, as I've already said, is exercising,
Correct.
stretching. Even 30 minutes of exercise a day can help them relieve the fatigue and actually feel good. Then the fourth thing is a very common thing, that once the baby comes, the whole focus has been shifted on the baby, and the mothers themselves do not take care of themselves and just take in as much as, not as much as, but usually more than they can handle. So not overburdening yourself with unnecessary things during those, just not just 5 days, but like for first 6 to 7 months, can actually help a lot with dealing with the fatigue and the mood swings as well. And then comes the medical issues, like if she's not having a proper diet. If usually what happens that after the baby is born, the iron supplements, the calcium supplements are like neglected and not even consulted to be continued. Like the doctor obviously tells, the gynec tells them to continue, but it is very easily neglected. And so those things should be avoided. And if there is a prolonged fatigue even after doing all those things, then surely consult your gynec, because then there needs to be something that needs to be checked and looked into. So these are the things.
That was quite informative. So now we have a couple of user questions coming in, which will be open to all the three of you. You all three can, give your inputs about the same. So the first question that we have is, can painkillers be taken to manage aches during menstrual cycle after pregnancy, and does it affect the breastfeeding?
Yes, she can go for painkiller. As far as possible, don't go for non-steroidal anti-inflammatory drug that is called as NSAID. You can go for milder painkillers like crocin or crocin plus combination of 5-syndromide. Nowadays, there are some new drugs in the market which are having anti-inflammatory action and they don't require any injection of antacid with the painkiller. If you go for NSAID, antacid is required, but they can be safely taken during breastfeeding, during menstruation.
Okay, Dr. Himani, do you want to add a few things?
Usually in my hospital we give them a ceftriaxone, like an antibiotic. We give them a diclopara, basically paracetamol, because she usually complains. We give episiotomy, so it pains a lot. So she sometimes we even give her injectables for painkillers. And there are times when she complains of fever and all of that. So we basically cover diclopara, like in diclofenic and paracetamol together. That's all we give. And sometimes we give vitamin C, multivitamin, and omeprazole, the basic anti-gastric. And sometimes we even give syrup lactulose, because if she has got episiotomy stitches, and then there shouldn't be a constipation. So we give her during the start, we give her syrup lactulose. And iron calcium, obviously, 180 days after the delivery, we continue giving her iron calcium. That's the main agenda. Yeah.
Dr. Anuja, do you want to add a few points?
Yes, yes. Actually, there is this biggest myth that you are not supposed to take painkillers when you are on your periods, and we just get to hear these things very often. But I would like to burst that bubble that if you are in pain and if you have consulted your physician, then there is no harm in taking any the painkiller, the thing which is going to help you relieve the pain from the pain. So yes, I would like to add that do not believe any of these things. Just consult your physician and do not go for Dr. Google. Just go and consult your physician and you can have the painkillers for sure.
Okay. Thank you so much, doctor. So the next question from a user is, does the type of delivery affect the period by which you get your first period after pregnancy? Dr. Balaram?
Generally, it doesn't affect, but if you see normal delivery people have good breastfeeding as compared to the cesarean patients. So normal delivery patients may get period earlier as compared to cesarean patient, but in practice we saw it doesn't affect much more whether it is a normal delivery or whether it is a cesarean. In both the things, proper hydration of the mother, proper iron, calcium, vitamins. She should take proper food. She should have a balanced diet in her diet. Many times now, because of focus change to baby, as told by Anuja, many times mother are neglected in so many families, and that happens to the fatigue and anemia in the babies. Nowadays, the government of India is also recommending to go for postpartum iron. Matlab, do check CBC in the postpartum period and hemoglobin is less. You should give them injectable iron also one shot before discharging to the home, because once they go home they may not take oral iron. So in so many programs, if you are seeing at Delhi and Maharashtra, they are recommending one dose of injectable iron to just take care of their anemia, and mother should be neglected.
Right. Thank you. Any other two panelists want to add a few points?
No, like Dr. Baliram has said, that's all we had to. I had to especially add on.
Okay. So moving on to the next question and the last one that we have from the users, that is, she had an IVF twin pregnancy and she's not got a period from last 9 months after childbirth. Should she be worried and how can she manage it? Anyone can go ahead.
In IVF pregnancy, there is a lot of stress, and in IVF baby, whenever patient goes through the IVF, there is a lot of stress throughout the pregnancy. Again, after delivery, there is a lot of stress, and to handle twins, it is really tedious job. If woman is doing regular breastfeeding, then she may expect she may not get menses earlier. Again, whenever she will get pain, she will get menses, she will have excessive pain and uterine cramping, because in twin pregnancy, the size of the uterus is little bit more in the size as compared to the singleton pregnancy. But she should not worry, but she should take backup contraception. She should check for her urine pregnancy test, because many times patient may conceive in lactational amenorrhea and they may not come to know that they are pregnant. And in IVF, they feel I can conceive naturally. So we are seeing so many patients after IVF delivery, they come with the positive urine pregnancy test just without their knowledge. And in this, stress factors matters. With her reason for IVF was the stress. So they should be properly counseled for the contraception, and they should go for either barrier contraceptive in the form of condoms or intrauterine copper device, or they should follow some another method, but they should see for the ovulation.
Okay. Thank you, doctor. Any do want to add any more points?
No.
Dr. Himani?
Very well explained by sir.
I was about to say that.
Yeah.
So we had a very, very informative session. All the user questions are done, and most of, I guess, was very, very elaborated and understood well by our users too. So thank you all the three panelists for joining us. We look forward to another session with you with another good topic to discuss on. So thanks again. Thanks for joining on BabyChakra. For all our users, you can consult the doctors directly or on the BabyChakra app. They will be available for you for any queries. Thank you again and have a good evening.
Yes, thank you,